in this case you don't have 3D because the computers don't support 3D. But you can see 3D, you can see everything. Now I show. It's very important. This is a case. Check the inclination of canine in maxilla. Check the root. No? If I take the angle, I want to check the difference between the inclination of the tooth and the teeth and the basal bone. Check. If I want to put the implant in the bone, I need to have 31 degrees of inclination. Huh? And I can to choose another teeth. Huh? The second is the same. Why? Because in maxilla, the inclination of the teeth is different. In this case, 29, 29. Depend of the teeth. I want to ask you, how you see this implant? Is good? Control that. Is the doctor very important? Show me the case. I have this case, I want to put the implant. Okay. And send me the patient. I make the X-ray and I show the this implant. Control. Is this good? The position? It's good. Huh? Perfect. Very nice in the center. Perfect in the bone. And I thought, okay, I want to check. Check. It's good? No, in the sinus. It's out of the bone. Why? Because the X-ray panoramic is one dimension. It's not possible to have the inclination, the position. And this is very important. It's very lucky because the implant maintained, but it's not correct. And if you maintain the inclination of the teeth in the maxilla, this is the results. The implant goes out. 99% you lose the implant. In this case, the doctor is very lucky doctor. But he made the implant in this area where you remove the root. He told me, I removed the root 1 month. I put the implant. I told him, okay, but it's very difficult. You have results. Why? Check. Very big. After 2 months, you have the same. It's a big defect. There is some problem. It's very important you maintain this inclination in order you touch the basal bone and you have regeneration. If you put the implant in this side, you lose the implant. For this is very important, the information. If you don't have a good information, we can work. I worked 20 years without 3D. I worked until 2 years ago, don't have 3D. But the information are very important. And if you have, or you make some mistake during the surgery, we can, because don't have a good information about the thickness, about the... Yes. And this is very important. Huh? But another question. For me, if I have this instrument, I take this, I measure the length, I measure the diameter, I check the inclination, it's not good, okay, I need to put here. Huh? But really, if I have 10 of length, it's 10. For me, it's very easy to choose the implant, the diameter. For this, I speak about the radar. Is this possible to have in the future? Soon, un futuro molto presto. This instrument for us. Because if you have this instrument to work in implantology, it's more easy. Maybe I think after September, October, we all in this or another seat, but I think we put one of these X-ray where it's very easy to read the imaging. But another question very important, the radiation for the patient is little. I study the whole radiation 3D. The radiation for the patient with the whole 3D is 2000 microsievert, is the unit of measure. With this X-ray, 14. Fantastic. To have the same radiation, I need to do 100 X-ray. For this is possible for me to repeat 2-3 X-ray without any risk for the patient. And this is very, very important instrument to work very well. Radiation is fantastic. And it's very easy to use this system because when the system is complex, for the doctor, they need to learn the software. It's difficult, but we have the imaging for increase or reduce. The imaging is same. We can change the position in very easy way. I can to measure. I have the possibility to insert the implant. Like in this case, I choose the implant. Okay, now I insert the implant I want to control. This is not a computer adapter, because this is slowly. But it's a computer adapt, it's quickly, you have image in 3D. In this case don't have because non support this. And you have inclination, you have diameter, you have everything. And work with this system is very, very, very easy. Okay? Now, the same instrument I can use Okay. I can use the same instrument for the sinus lift. Why? Because the design is rounded, even the letter is rounded, but little. For this I can use with the stop, I can use in the preparation. And I can use for lift the sinus. I show the video. Purtroppo devo andare così. Yeah, sorry, but it's not a computer, my computer. Cos'è? Cinese? Sono piccolini, ma non sempre detto. cinese, no, il cinese.
cinese.
Dov'è il cinese?
Sotto l'ultimo.
No, è sotto la fine.
Sì.
Ok, this. Okay. When in the posterior area I don't have a bone to leave to insert the implant because I have 5-6 millimeter, I can use this system. I perform only the cortica, and with the first instrument, come back a little. With X-ray, I measure the length of the ridge. Generally 5-6 millimeters. Okay? Now I need